Right now, the precaution dose, also known as the booster dose of COVID, will now be available to 18 plus population group. Now, this is from April 10th onwards. Now, the same vaccine will be given, that has been given for the primary doses, will be given as precautionary doses as well. Now, meanwhile, free vaccination programs to health workers and the frontline workers, as well as those above 60 years of age, will continue free of cost at the government vaccination centers. Now, this is, of course, the big focus of this hour, where the government has now decided to give booster shots and make them available to all. Now, this, when we say to all, it is to the 18 plus age group. Now, this will start from day after tomorrow, from April 10th. The same vaccine will be given as booster dose, which was given as the primary doses. The first two doses will be the same. So the government there saying no mix and match of the vaccine doses. And of course, the free vaccination program will continue for health workers, frontline workers, as well as 60 plus population at the government vaccination centers. All right, we're being joined by two of our guests, Dr. Rajiv Das Gupta, National COVID Task Force, as well as Dr. M.C. Mishra, former director of AIIMS, to understand what this big move by the government means. Both of you, thank you so much for joining me here on Mirror Now. I'd like to start with Dr. Rajiv Das Gupta first. So, this booster shot for 18 plus is something that we've been waiting for a very long time. If you could share details of what the plan is, things like who will be given the first, the priority list of who will be vaccinated first, the dose gap that is required between these doses. Dr. Rajiv Das Gupta, that question is for you actually. All right, we seem to be having some trouble with Dr. Rajiv Das Gupta. We'll try connecting with him again. Meanwhile, Dr. M.C. Mishra, I'd like to take a question from you. Do you think that, given the fact that the cases are at an all-time low in India, and also the fact that many states are, they've lifted their COVID curbs, and now that the government has decided that the booster doses will be made available to everybody, there is a need to once again make people aware of the importance of the booster dose?
Absolutely. I think that it's a very significant step forward by the government, allowing everyone 18 plus to receive not only the first, second doses, those who have not received so far, because there is a population who have not got even the first or second dose yet, I know. And booster or third dose or precautionary dose, whatever we may say, for those who have already received the first and second doses 6 months prior than now. So I think it's basically, if we look at the trajectory of the whole pandemic for India, we are in a very comfortable situation currently. That is largely because of the first, second, and third wave of infections, which basically was acquired or contracted by most of us. And besides that, our vaccination program has run very smoothly. And we prioritized in the beginning, looking at the availability of the vaccines and the doses. And then we opened it up gradually for 60 plus, then with comorbidities, 45 plus, and then for everyone. So I think it has been a gradual process, looking at the risk and benefit of vaccination, and also looking at our availability of the vaccines, availability of the doses. So this is something which will further strengthen our position as far as pandemic is concerned. as most of us feel that now the COVID has become endemic, and the virus will remain amongst us until and unless we get some kind of a total transformed virus like the Delta variant last year, April, May. We are unlikely to see the bad times again. If we get something like Omicron or Omicron variant, BA2 or BA.1, and its sublineages, because these, as we move on, as we do the genomic sequencing, a lot of variants will come on our way. But not every variant will be serious, or not every variant would be of concern. And we have to live with them with our precautionary measures, what we have been terming as COVID appropriate behavior, although the mask is no longer mandatory and there are no fines have been withdrawn by not putting on mask. But I would say for every one of us must realize that mask has done a lot of good. Besides COVID, it has also prevented other infections like tuberculosis, other viral infections, the pollution per se, which also kills millions of people and also leads to respiratory illnesses. The lung cancer incidence has increased in the country. So putting on mask is something which should become a part and parcel of our daily wear. And when we go out of our homes at work, and whenever we are in closed door meetings, if we have comorbidities, we must take extra caution by putting on mask. And also if we are going in large gatherings where we don't know who will be carrying what infection, whether COVID or non-COVID infection. So I think masks will go a long way in protecting all of us whenever we are in a crowded place, in public transport, shopping areas where there is a lot of crowd. But yes, cautionary taking off mask in restaurants is now allowed when you are eating, you are drinking. But that is for, you know, that you are in a bubble with your known people who are not sick, who are not ill. So I think this precautionary dose or booster or third dose, because a lot of us felt in the beginning that it might be a 3-dose vaccine. But the only thing we have to now see that how soon we have to revaccinate ourselves after the precautionary dose.
In
so
fact,
that recommendation will come with passage of time.
Absolutely. In fact, Dr. Mishra, you're making some very important points, especially the fact that mask is our only protection, and that is something, we should not let it go. Sir, stay on with us. I have lots to discuss with you. I'd also at this point like to go to Dr. Rajiv Das Gupta, the member of the National Task Force. He's joined us back. So thank you so much for joining us. Now, I want to understand from you, now that the government has decided to open up, the booster shots for 18 plus, what is the roadmap ahead? Is there a list of priority people who will be vaccinated first? And also, what is the dose gap requirement currently if you have to take the booster dose?
Thank you. The answer to the last question first, that what is the gap? The gap as specified now is 9 months, so 9 months after the second dose. And therefore, that is something which is going to be regulated through the COVID platform, which remains the basic workhorse as far as scheduling of doses and monitoring of the doses are concerned. So all those above 18, barring those who have already got the third dose, if they're 60 plus or health workers, frontline workers, etc., can now schedule their booster dose. The important point being that all of these will be available only through private institutions, which means that it will be a paid third dose or a booster dose and not part of the package of free doses, as it seems from the PIB statement that was released some time back.
All right, Dr. Rajiv Das Gupta, also my next question to you is the government considering, reducing this time gap, like you mentioned, the 9 months time gap, and also is the government also considering a mix and match of the vaccines like, it is taking place in certain other countries?
Yes, the mix and match has been under consideration for some time. There has been research studies within India also. But at this point, the expert group in its wisdom has opined that it's going to be the same vaccine that you took your 2 doses with, or the primary schedule with, and that vaccine will continue to be the third one or the booster one for each one of us.
All right, and so any word on how effective this booster dose will be against the new variants that we're seeing, the new Omicron variants that seeing, such as the ones in China, which are primarily responsible for the massive surge in cases over there?
The global experience certainly is that COVID vaccines in general, plus the booster doses, have certainly protected against severe disease, against hospitalization and death. It should be made clear that this is not going to dramatically cut down new infections, in the sense that vaccines with immune escape properties, such as we have seen with Omicron or earlier with Delta, shall continue or may continue to infect us. But what 2 doses or 3 doses? And now, for example, the UK has decided on a 4th dose for those who are aged above 75 and anyone with extra vulnerabilities, particularly immunological conditions 12 plus. They are now entitled for a 4th dose. Be that as it may, so the primary schedule plus booster doses definitely convincingly protect against hospitalization and death. And that really is the biggest advantage and the biggest lesson that we have from this cumulative global experience.
All right. Also, Dr. Mishra, do you think that, considering that the vaccination rate among children is, significantly less, do you think that there is still a certain level of hesitancy among people?
Yes, Apeksha, if you look at the children contracting the illness has been very low over last 2 years since the pandemic began. And very few hospitalizations, occasional mortality or multi-system inflammatory syndrome, etc. have happened, but occasionally, very rarely. So neither the children themselves are excited about vaccine, nor their parents are excited about vaccines. And there has been a difference of opinion amongst the public health experts also about vaccinating children in a big way. So now the vaccines are available like the other vaccines. So if the parents agree, if children, at least the older children above 12, between 12 and 18, they can get the opportunity to get vaccinated themselves, which is a good idea. What we would say, because even if they don't fall sick, they can carry the infection at home and can then pass the infection to their elders. So from that perspective, I think it is important. Otherwise, there has been a difference of opinion about vaccinating children with the same enthusiasm, with the same efficacy, or with the same force as adults has not taken place.
All right. Dr. Dasgupta and Dr. Mishra, both of you, thank you so much for joining us on Mirror Now. It's been a pleasure talking to both of you.
Thank you.
Thank you.